Good afternoon, North Dakota. Thanks for joining us today. And for those watching online or on TV, we appreciate your patience as we sorted through some technical difficulties, but everything's now working. So thanks to the tech team for getting everything up and going. It's always a good reminder when we begin these COVID press conferences, press briefings, to remind ourselves as a state what our strategic goals have been and what our focus has been on since the start of the pandemic. So let's just begin with the why. We've used the phrase often about talking about saving lives and livelihoods. But when we talk about this, we're not just focusing strictly on physical health, but also on mental health, behavioral health, economic health, which are also key factors to well-being. And of course, part of this we know for mental health and economic health has to do with getting all of our kids back in school. And so with our K-12 Smart Restart and the Healthy Return to Learning efforts, again, we're off to at least so far so good, largely successful start to the school year. The school teams are continuing to learn as they go and make smart decisions to help allow our students to be in school and stay in school. And a number of districts are moving towards more 5-day learning as opposed to hybrid as a way to reduce transmissible moments by having kids in their cohorts. We've also been really focused on protecting the most vulnerable among us, which is the elderly and those with underlying health conditions where we know that this coronavirus can be particularly deadly. And with our Vulnerable Population Protection Plan, we've been a national leader in that regard. And of course, by doing all of these things, again, the one way we save lives, particularly among those most vulnerable, is that we all do our part to help slow the spread so we can ensure that we've got adequate healthcare capacity. That's both in terms of healthcare staff, whether that's in terms of long-term care staff or at hospital or clinic staff, and then we've got the right equipment and treatment. And of course, again, by slowing the spread, we know a lot more than we did 6 months ago, and a person's ability to likely survive even a serious bout with COVID-19 is better today than it was 6 months ago, and you see that by the dropping fatality rates across our nation. There are some areas for concern. One of those is we do track, as everyone knows, we're trying to test residents and long-term care health workers weekly, and we've seen positive rates increase in the past couple of weeks, both among staff and of residents. And while the long-term positive rate is still below the community positive rate, over the weekend it was 4.7% for residents and 5.9% for staff. And that, again, for staff then starts to reflect what we've said, which is if the staff are in the community, they can often start reflecting the rate that's in a community. But that's just too high. We've been fortunate. We've been low in the number of fatalities here in North Dakota, but we know that where those numbers can start to rise is if infection gets into congregate living like long-term care, and so again we need to continue to remain really vigilant against the virus to protect our most vulnerable and to keep our schools opening. So we're continuing to watch those numbers closely. If we can bring rapid screening tests to bear, perhaps that can help us to facilitate visitation and do that safely. And continue to look at other things other changes we can make. But we know that we've got a number of long-term care facilities that are been hit relatively hard, and we know that this is a real risk for us. And when community spread happens in cities and towns, it's more likely to end up in our nursing homes, and no one wants that. And when we talk about protecting the elderly and the most vulnerable, it's not just those that are currently residing in long-term care facilities, because as we've talked about from the onset, sadly, about 20% of North Dakotans, which would be close to 150,000 people, would fall into a category of having the high-risk comorbidities with COVID, like heart disease, obesity, or diabetes, or other related health issues that can cause really serious illness or death with COVID. We also know that there's COVID fatigue out there, but again, when we talk about everyone, whether it's healthcare workers to businesses, business owners to students, we ask everyone to keep fighting the fight, because what you do makes a difference for those that are most vulnerable, and it also can help, as you say, keep our schools open. We know that we've got a challenge in keeping our schools open relating to protecting our teacher workforce, and we know that we've got a shortage of substitute teachers around the state. And so again, the work that you do, the work that you can each individually do, can help us protect teachers and keep our kids in school, which is great for the kids and their mental well-being, and as well as their education. And if you're being smart about being around the community, you can also keep our healthcare workers safe that are maybe that you may be next to you when you're shopping. They may be sitting next to you in church, but these are folks that when they go to work, they're going to work with our most vulnerable. And so again, we want to get back, talk about the North Dakota SMART guidelines that we always do, which has to do with, again, social distancing, wearing face masks, avoiding large gatherings, washing your hands frequently. These are all important things that we can do. And then again, I want to just put an extra note that we haven't mentioned before, but if you're one of those individuals that has been tested positive, even if you're young and asymptomatic, I would like to just say that you've got an extra responsibility. And if you're positive, and your responsibility is to make sure that during the time that you're contagious, that you do not infect anyone else. If every single person in our state right now, which is all of the actives in our state, if all of those actives, the 2,758 actives, if each of those were really diligent about making sure they didn't infect anybody else, we could take this virus down dramatically in a hurry. And so again, if you're someone who's positive or a close contact of a positive, you have an extra responsibility to help slow the spread. So again, thank you for what you're doing. When we take a look at the numbers from this last, over the last 7-day period, 2,049 new cases, 1,214 recovered, and 14 deaths reported over the last week. We're now at 2,758 active confirmed cases. I would just share an observation, which we're trying to drive more into the data, but typically on Tuesdays is often a day when we see a bigger increase in recovereds, because while we do testing over the weekend, sometimes people that present for testing on a weekend are those people that say, I can't wait to get a test until Monday because I'm symptomatic. And we have seen an increase in recent weeks of the number of people that are testing that are symptomatic. But then on Monday is usually when people might be touching base with a physician or they're clearing their period of time when they're recovered. And so I would expect, we do have some individual day variances between when we see positive new cases versus when we see recovered. And again, that's why we like to look at these over a 7-day or 14-day period. But with the 2,049 confirmed cases identified out of 39,125 tests in the last week, that brings the last week's positive rate of tests to 5.2% as positive tests divided by the percentage of total tests. And again, we'll talk more about this today, about calculating percentages, but this is the way the CDC has done it, and now thankfully this is also the way the CDC COVID data tracker calculates positivity. So that's we've always been in line with that. We'll talk later about some of the volunteer non-government sites, but this number matches the CDC site. We have now completed just over 546,000 tests of North Dakotans. And of course, the strategy in doing this comprehensive and robust testing is to make an invisible enemy visible. And again, I thank everybody involved in that in this testing effort, because it has helped us do almost better than any other state identify where the virus is and give us the information we need to try to control its spread. When we take a look at the 14-day average has remained relatively flat in recent days, and this is good news. Today it's at 5.65 on the rolling 14-day, which is slightly higher than the 5.2, which is the weekly. So again, this is good that we're staying here in the low fives, and we like it when it's going flat. We'd like to have it be going down overall as a state, because we want to get back under 5% is where we're trying to shoot for. I would say that, again, when we say it's been relatively flat, as you'll hear, it's a combination of that rate going down in some parts of the state and going up in other parts of the state. We do have various rates of positive test rate and various rates of infection rate around the state. Currently, there's 65 people that are hospitalized, and again, we do have people that have said, well, gee, why are you doing all of this work? Because we aren't using much hospitalization. I would say we have low hospitalization because of all the great work that North Dakotans have been doing. And so again, I want to just say thank you to everybody who's doing their part to be North Dakota Smart, because you are helping to save lives, and you're helping to keep people out of the hospital. And again, we have been relatively flat for several weeks, and with 65 people hospitalized, that's a very small percentage of our hospital capacity going towards COVID. Our hospitals are very busy, and some of them are doing a lot of business because people are coming back in for elective surgeries, et cetera. We have, sadly, in the last 7 days, there have been 14 deaths. This is spanning 8 men and 6 women from their 50s to their 90s. 6 of those were from right here in Burleigh County. But again, we want to say to all of those families and friends who've lost a loved one during this pandemic that our hearts and prayers go out to each of them. From an active cases standpoint, of North Dakota's 53 counties, all but 4 of them have at least one active case currently. The counties that have no active cases are shown in gray. The darker the color of the county, the more cases that there are. And right here in Burleigh Morton is where we've got the highest number of active cases, 513 active cases in Burleigh, 216 active cases found in Morton County, for a combined 729 active cases here. That's 25% of the active cases in the state, approximately. But other large metros, as it often has been during this pandemic around the country and around our state, the virus tends to show up more in places where we've got higher density of population and more transmissible moments in either commercial or public spaces. So other counties with high active case counts include Cass County with 480, Grand Forks County with 273, Stark County with 249, Ward County with 197, Williams County with 171, and Stutzman at 160. And if you take a look at these 8 counties, which represent some of our, and also include our larger metro areas, these 8 counties represent 82% of the active cases statewide. And how do you make that actionable? Well, if you live in one of the 45 counties that's not one of the 8 that has the 82 active cases. So if you don't live in Burleigh or Morton or Grand Forks or Stark or Cass or Ward or Williams or Stutzman, but you live in a surrounding area and you drive to one of these areas for travel, for shopping, for appointments, or for other activities, again, take extra precaution when you go to those in terms of social distancing, wearing a mask, practicing good hand hygiene when you're traveling those, and reduce. And something we talked about early on, but it's been proven out by some large-scale studies that have been done, and just makes complete common sense. But if you were to, those individuals that figured out a way to, say, consolidate and go shopping 1 day a week as opposed to shopping 7 days a week, fewer trips to commercial locations, consolidating those created fewer transmissible moments, and in some cases dramatically reduced the likelihood of someone getting the infection. So again, if you're living outside these more areas with more cases, take extra care when you're traveling to them. On the next thing we want to talk about is the the counties, well, I guess we're going to talk about that a little bit later. We're going to talk right now, I think we're going to talk about the COVID tracking update. COVID tracking update is a site, COVID tracking project is a volunteer site that is staffed by volunteers, originally created by the Atlantic magazine. So it's a non-governmental volunteer site. They early on, we're filling a need, and we're doing pulling data from lots of different sources, and it became a easy place for national news organizations and even health agencies or health organizations like Johns Hopkins to pull data from. We have been working throughout the summer to try to get the data on COVID data, the COVID tracking project, this volunteer site, to match what the CDC had and what North Dakota had. The fact that it didn't led to a number of national articles where North Dakota's positivity rate was misrepresented in some cases by almost a factor of 4 times higher in national articles than the reality. And this was because they were not counting all of our tests. And we have been able to connect. Last week we had good I'd say finally, connection with COVID tracking project team, and they have we have come to an understanding agreement about definitions of what test encounters mean, and that definition that they're using on test encounters has been added to our website. Test encounters is a number that is extremely close to what we called total tests, as opposed to, they were pulling a number for the different individuals that test, but because of our high rate of serial testing, meaning testing like residents in a long-term care facility every week, that testing, all still PCR, all still gold standard testing. These are all the very best of tests, but because we were doing a lot of that, which we know, even relative to our peer group in the FEMA region, we're doing anywhere between 3 and 10 times the rate of testing of the other 5 states in the region, which includes Colorado, Montana, South Dakota, Utah, and Wyoming. So with this collaboration and syncing up with the COVID tracking project, we're one of 6 states now that reports test encounters, along with New York, Rhode Island, Washington, Virginia, and Colorado. And of those 4 states, only 4 also report the unique people tested, which we've been doing since the get-go. So we're along with Rhode Island, Colorado, and Washington. And then also, so now we've not taken anything away because we're committed to transparency as well as being data-driven. And so we're the only state which is providing all 3 metrics. One is encounters, the second is total specimens or total tests, and the third is unique individuals that were tested. And we like to think, of course, everybody in North Dakota is unique, but what we mean by that is that if someone got tested more than once, we only counted them once in the unique people category. As a result of all this work, the bottom line is we're now seeing our positive rate being accurately reported at the same levels that we're talking about here by most, but not all organizations. But when COVID tracking fixed theirs, a few days later it flowed through, and now it's being correctly reported by Johns Hopkins, et cetera. But yet some aren't telling the whole story. And as we have gone from nationally, again, it's important to note that as a country, the great things are happening on this front. We've gone, even with increased testing across the nation, we've gone from 66,000 new cases per day in late July down to about 40,000 per day in mid-September. That should be a huge headline because we're absolutely positively as a country going in the right direction. But as this virus has spread around the country, first in the Northeast, then in the South, and the Southwest. It is now making its way through the Midwest, and we've seen a number of states in the Midwest with higher number of cases. But again, we want to make sure that we're understanding and telling the whole story. Over the weekend, there was a national article about the Dakotas leading the nation in virus growth, and it was relying on a couple things. It relied on the fact that in the case of North Dakota, we were very low before. So if you're low and the rest of the nation is going down and we're going up, still at very good levels, like the 5% level, then you have to stop talking about positivity rates and rely on primarily on per capita. It didn't mention in the story that North Dakota was doing 4 to 5 times more testing than some of our neighbors, and it did mention in the national story that South Dakota has 17% positive rate, but it did not mention North Dakota's rate, which we just talked about, which is in the low 5% range. But I think this context is important to explaining it, and we've got a few slides that we want to walk through to talk about this math. And the first is that if you're going to compare cases per capita, and I mentioned this in response to a question last week, it's only comparable if each state had the same level of testing, because if you were doing the same amount of testing per capita, then you could compare the amount of positive outcomes per capita. So an example is if state number 1 did 1,000 tests, it was 5%, you'd have 50. If state B was doing 5 times as much testing, 5,000 tests, they had the same positivity rate, they would be identifying 250 cases. So if the population, if you normalize that on a per capita basis, state B would look like they're having more of an outbreak when in fact they may just be doing a better job of testing. So to continue that on, without this context of explaining the variations in testing program, new cases per capita can paint an incomplete picture. And we certainly do take a look at per capita even here in North Dakota, but when we look at per capita by county, we also look at how much testing is going on in that county to make sure that we're being accurate. And then we also, as part of our work, if we have a low population county with a few cases that might skew that, then we look at that differently. And certainly in the case of the U.S., with North Dakota representing 1/3 of 1% of the population of our country, then the few cases that we have here in North Dakota, have been, I think, used to try to skew a national story, which the national story is really that the number of cases have dropped by over 25,000 per day in the last few months. So let's keep our eye on that. The other thing which we want to take a look at too when we talk about growth, if we've been at 1 or 2% and we go to 5%, we could be leading in the virus growth, if you will. But our positivity rate now at 5%, let's remember, it was just only a few months ago when New York and Arizona they were declaring victory on the way down from 20% in the case of Arizona for a while. New York in early April had a 7-day rolling average positivity rate of 48%. When they got below 10 is when people started thinking about opening up, and 5 was victory. We've done such a good job in North Dakota of having low rates all summer that I'm sure 5% is high. And like I said, a trend line, if it's going up, we want to make sure we're stopping the spread. But I want everyone in North Dakota to feel great about their effort because, again, compared to virtually every other state, whether it's the testing, the positivity rate, or the hospitalizations, fatality, North Dakota is doing extremely well. This morning, we were pleased to hear that the U.S. Health and Human Services Secretary for HHS at the national level, Alex Azar, was on a local statewide radio show and complimenting what he said was an incredible testing system and regimen here in North Dakota. And again, as Secretary Azar noted, there are 2 real roles to testing. One is diagnostics, which is if someone is sick, they come in, they say, hey, I'm nervous about what I have, could you give me a test? They get tested, and it turns out if they've got COVID, then we're able to treat it and help save lives. The other kind of testing is surveillance testing, like what we're doing when with back to school testing with college students, which is we wanted to know as students were entering the campus, even though no one might have been feeling ill, how many of them were potentially asymptomatic spreaders, so that we could help protect those and their families, those in the community, and those around them. And as we're doing surveillance testing, and we're doing it quite well, it's why we're the second highest per capita testing rate in the nation behind New York. And also, again, the White House, which we're working very closely with, we had another phone call with Dr. Birx and that was with our staff and Chris Jones and Tammy Miller talking to her last Saturday. tracking the White House recommendations, which again, conducting weekly testing in our long-term care, which is now the national standard. We've been doing that since last spring, but now CMS is recommending that. Utilizing universities for testing, which is another recommendation coming out of the White House Coronavirus Task Force. We're working with UND on plans to install a Hologic Panther machine at UND labs, and we're also working with NDSU's veterinary lab, which will be able to do human specimens. These labs will get certified. They'll be able to validate specimens, and also we're looking at doing some 3-to-1 test pooling at NDSU. We've also engaged students from UND and NDSU from healthcare curriculums to get involved in assisting with contact tracing. And then we're also, which is another federal recommendation, working with NDSU, Department of Environmental Quality at the state level, and the North Dakota Department of Health, doing wastewater testing research, and that's underway in our 3 largest metro areas, Fargo, Grand Forks, and Bismarck. Results are still being analyzed, but that could be a useful tool for more broad-scale surveillance. And again, as the White House had recommended, we're continuing to take a look at and adjust coronavirus risk levels for highly affected communities, which brings us to the next topic, which is the county risk level update. I'll kick off this section by saying that today we're not making any changes to the current risk levels that we announced just about 10 days ago. And as you'll recall, we began using those county-by-county risk levels on Friday, September 4th. We're continuing to monitor the 14-day rolling averages, and while we're not making any changes, we do have a couple of counties that we're putting a particular eye on that have a combination of high number of active cases and now high relative to the rest of the state positivity rates with good solid testing. And so those the 2 that are on the top of our list here are Stark County and Williams County. These both were moved to the yellow category or moderate risk 10 days ago. But Stark County with 249 cases and a 10.6% positivity rate, and Williams County with 171 cases and 9.6%. Again, areas where we're saying we want to keep an eye on it. We're going to strongly encourage those counties and the cities within them, and we'll be reaching out to each of them in the days ahead here to discuss their level of local coordination. We know that the local level of coordination and readiness has varied across the state. We know that some counties last spring worked with the cities and their universities and school districts and set up teams or task forces, and then some of those during the summer got put on hold. And so we'll be having a discussion on whether or not they want to, what level of local coordination, including whether they should set up a task force if they want to decide to do that. And particularly we're interested in working with them as they develop a plan to see if they need any help with state resources. So as the counties and the cities and the school districts and the universities in these communities work together with their local public health and with the local health providers, as they come together, if they're short of resources, we're going to be ready and willing to help out and to support them. And again, we'll be doing this through our Department of Emergency Services, through the Department of Health, with our incredible National Guard members, which as of today, there's 332 soldiers that are out there today helping with this pandemic. But we would stand ready to help each of them as they work forward. But again, we're encouraging any county that has got triple-digit actives should be thinking about whether or not they need to do a higher level of coordination. And again, we'll be reaching out to each of them. We also want to, some of the counties that have increasing percent of positivity also include and border or share geography with our tribal nations, and we'll continue as we have throughout this to stay coordinated with the tribal leadership to see whatever additional assistance they may need. Next topic is the updated Smart Restart guidance. As you might remember, this was the Smart Restart guidance had to do primarily with commercial businesses. This was worked on in conjunction with our Department of Health and our Department of Commerce, and input from dozens of different industry groups when we built this, and we did that last spring. We're updating those as we committed that we would regularly do, and one of the things that we're doing on those guidelines is to place additional emphasis on the importance of face coverings or masks as a mitigation measure. And if for businesses that are in the moderate or risk, the yellow counties that necessitate or higher, if you're in the yellow or higher, then it necessitates on-site work that might put people face-to-face with customers. The guidelines, again, these are guidelines, not mandates, but the guidelines within the updated Smart Research now recommend that pre-screening and monitoring employees for symptoms, complying with social distancing guidelines wherever possible. We're not requiring the use of masks, and of course following the cleaning guidelines. And again, the reason why we're doing this is because we know from the data from around the rest of the country that masks work as a way to slow the spread. And we also know that for those that are interested in keeping our schools open, keeping our businesses open, for those that care about freedom and liberty, the least restrictive thing that people can do is to voluntarily wear a mask, because this is a way that we can, again, doesn't require any significant spending at the state or federal level. And again, for business owners, they may find this is a smart way to protect their workforce, because by masking, you may be able to keep people on the job as opposed to have them contract COVID and be quarantined or isolated for 10 to 14 days and lose that workforce. So again, this is a great thing for your employees, a great thing for your customers, and a great thing for all the vulnerable around the state that we're trying to protect. And it's also for commercial businesses to engage. We've seen a number of national commercial businesses, including all the big box retailers, require this of their team members, and they require it of customers. It seems like their business is doing, many of them are doing gangbuster business with these national requirements. They're doing that because they know as employers, in some case, some of the big box employers employ more people nationwide than we have citizens in our state. One of them, it's more than 2x more than citizens in our state, and they have found that by requiring masks for their team members is a way to keep their stores open and their businesses strong. So again, our path towards freedom is to do the things that are the least restrictive, and so this is a guideline, and again, the recommendation changes in the updated Smart Restart guidance includes recommending that businesses that are in these moderate risk or yellow areas or higher, that they require the use of masks for their team members, and that they recommend them strongly for their customers. Okay, that's all on that topic. Next is the Main Street Summit. In the Main Street Summit, which is scheduled for October 6th and 7th, it's the perfect opportunity for us to have a statewide virtual conversation about our future and resiliency. We know that this COVID is changing how people commute, how people work, what office environments are going to look like, and where people live, and what space is required to achieve distancing in some cases. So with a focus on building resilient communities, this conference will be held in partnership with the Economic Development Association of North Dakota, the North Dakota Council of the Arts, and Prairie Family Business. So thank you to those sponsors. We'll have a number of keynotes from around the country, and that'll share their experience and knowledge on how to build resilient, healthy, and vibrant communities. A couple of those include the Transformational Community Leadership Podcast veterans, Dennis Frazee and Jason Hutchinson from the organization called Develop This. We'll also have some top educational and comprehensive breakout sessions, special guest appearances from North Dakota regional artists, and including Jesse Veeder and Chuck Suchi and others. And registration is now open. It's only $20 at mainstreetsummitnd.com. That's $20 at mainstreetsummitnd.com. mainstreetsummitnd.com. First 500 registrants, that could be you right now, first 500 receive a Main Street Summit gift in the mail. So reserve your spot now. If you're one of the first 500, you'll get this free gift. The conference provides opportunities, community leaders, students, and professional economic developers an opportunity to attend one of the largest community development events in the region. For more information and to register, you can visit msnd.link/2020. And again, there will be, well, it is virtual, there will be live presentations, including a number of folks and a number of state agencies that are going to be participating in this, from DOT to Commerce to the Health Department to you name it. We'll have a strong presence from the state of North Dakota there to help all of our communities become more resilient. The next topic is behavioral health update. Last week, I signed a proclamation identifying September as Suicide Prevention Month in North Dakota, calling on residents to know the signs, identify who's at risk, and be prepared to help. We touched on this briefly last week, but since we're still in the month of September, wanted to go even a little deeper into this important topic. In 2019, sadly, 134 of our fellow North Dakotans died by suicide. But even more shockingly, and maybe less well known, there was 1,194 suicide attempts. The suicide rate in North Dakota is 25% higher than the national average, and that's certainly a cause for concern. But there is no single cause for suicide. However, most often occurs when stressors and health issues converge to create an experience of hopelessness and despair. Risk factors and characteristics or conditions could include stressful life events, whether it's rejection, divorce, financial crisis, bullying, other life transitions or loss. Conditions like depression, anxiety, substance abuse, especially when unaddressed, dramatically increase the risk for suicide. North Dakota data suggests that individuals at highest risk include males, Native Americans, older adults, veterans, those living in rural areas, and LGBTQ youth and adults. You can be the difference in getting someone the help they need when they're struggling emotionally or have a hard time. And these are just 5 simple steps. But the first one is one which I know people are often nervous about if they think that someone is struggling and they are concerned about asking the basic question, are you thinking about suicide? All of the professionals in this space say this is absolutely the right question to just get it out on the table and expose that hidden thought. So just number one, if you're concerned about someone, just ask them, are you thinking about suicide? Number 2, keep them safe. Establish their immediate safety. And this could be a number of things to do to make sure that they're in a safe place and away from things that might cause them harm. But I guess the third thing is tied to that, which is be there. Be physically present for someone. And if you can't be physically present, see if you can get someone else who can, if you're distant from them, maybe call someone who's nearby or a neighbor that can go be with them. And then in the meantime, just keep speaking with them on the phone. And then help them connect them with community resources and professionals. And then lastly, follow up to see how they're doing. Suicide is a preventable public health problem, and when you can be the difference in getting someone the help they need. You can visit behavioralhealth.nd.gov to learn more about the 5 steps you can take to help save a life, or at any time, 7x24, no charge, 1-800-273-TALK to speak to someone, whether it's about your concerns, your feelings, your emotions, or whether it's someone in your life that you're worried about. 1-800-273-TALK. Next topic is the census update. This is another one of, I'd say, good news and bad news. But the Census Bureau is conducting door-to-door enumeration, meaning they're coming around to count and the people knocking on your door are enumerators. When They'll continue visiting, and whose doors they're knocking on? They're knocking on the households that have not responded to the 2020 census. They're physically visiting non-response household with the intent of getting them to fill out the census. 74% of non-responding households have now been visited, and so again, if you're one of those households that has not responded, the chances of you being visited yet, if you haven't been already, is nearly 100% if you haven't filled out the form. And so if you want to reduce the chances of someone visiting your door, during COVID or any time during the census, go online right now. It takes only a few minutes. So my2020census.gov, and you can respond without the code that was sent to your house. But if you do have that code, that'll make things easier and quicker. But I've gone through this myself, and it literally can just take a very short period of time. For those people in North Dakota that may have a second home or a lake home or a cabin in the Badlands, if that's not your full-time residence, someone may be coming and try to knock there on the door as well. And you can also go on the my2020census.gov and indicate that no one lives at that residence. You can also, if you don't want to have access to being online, you can call 844-30-2020 and talk to them. You can also just complete and mail back the paper questionnaire. But let's talk about how we're doing. I think we had a slide up here that showed our results. Burleigh County is not only leading in COVID, they're also leading in the number of people that have fulfilled the census, 77.7%. Morton County second at 70.9%. Stutzman County at 70.8%. But let's flip to the other end. So North Dakota our self-response rate was slightly lower than the national average, and we're behind where we were in 2010 when we know we had an undercount. And why does undercounting matter? Because if we get undercounted, it's over $60,000 over the next 10-year period that would come into the state per individual, and this helps pay for roads, for schools, for nutrition, for health programs. So being counted really matters. The most severely undercounted areas in the state are rural and western counties, as well as those counties which share geography with our tribal nations. But this would be a devastating loss of federal support dollars for programs in the next 10 years if we don't get these up. But Rolette County, response rate 31.8%, McKenzie County 33.1%, Sioux County 34.6%, Montreal County 35.9%, Benson County 36.8%, and Divide County 41.3%. So again, we got some work to do. If you're in one of those counties, or if you have not filled out your form, or if you're unsure if you have, you can still go to my2020census.gov and check to see if your information is complete. Next topic is National Preparedness Month. And while it may seem like we've been in a kind of a continual state of emergency for the past 3 years, moving from one emergency to another, we do want everybody to know that North Dakota is observing National Preparedness Month. It's held each September. It's designed to promote family and community disaster planning now and throughout the year. The theme is disasters don't wait, make your plan today. And again, we know that even during the COVID-19 pandemic, on top of that, we can have natural disasters and emergencies can occur, as we're seeing in other parts of the country. So North Dakotans know from experience that taking steps to prepare ahead of time can help you respond more efficiently and safely during an emergency, especially during our periods of time when we've got challenging weather. And the fact the state of North Dakota is helping out some other states right now. And while we don't have hurricanes or earthquakes here, at least so far in North Dakota, we know that other parts of the nation have been dealing with that, and now they're dealing with devastating wildfires on the West Coast. The North Dakota is responding through a Emergency Management Assistance Compact, or EMAC, if you're familiar with that, EMAC. It's a mechanism that allows states to send personnel, equipment, and supplies to assist with the response and recovery in other states. And North Dakota's got a long history of being someone who stands up and helps when other parts of the nation are challenged. And since 2005, our DES, our Department of Emergency Service staff, have supported response agencies, including things like Hurricane Katrina in Louisiana, volcanoes in Hawaii, and most recently Oklahoma last year for flooding and tornadoes. Those are just a few of the examples. But now we're sending a firefighter task force to Oregon. State of Oregon made the request. It's comprised of 12 firefighters and 1 task force leader. The leaders coming from Williston, Grand Forks, and Fargo. And Williston are providing the personnel. The team is going to bring 3 fire trucks and 2 support vehicles. They reported today to the North Dakota Forest Service Firehouse in Bismarck for coordinating instructions and to be issued additional equipment. They'll leave today. If they haven't already, they'll be boots on the ground in Oregon for the next 14 days. North Dakota's teams, of course, are trained in urban firefighting, so you may ask yourself, why would they be going to fight forest fires? But they're going to be located at a base camp in Oregon where they'll operate their engines to protect structures, which would be more typical of urban firefighting, protect communities and homes and buildings from advancing wildfires. There's currently 38 active wildfires threatening several communities in western Oregon, and our hearts go out to the families and all those that have been impacted by this devastation, including and especially those families who've got a family member who's either perished or is missing right now during this during these fires. So again, back to our Preparedness Month. Again, want to thank those firefighters for representing North Dakota. Want to thank them for all they do here. But as we come back to Preparedness Month, there are 4 things that anybody can do: make a plan, build a kit, prepare for disasters, and teach youth about preparedness. Talk to your kids about preparing for emergencies, and have a plan. But I encourage all North Dakotans to learn more about these 4 steps at ndresponse.gov. Again, disasters don't wait, so make your plan today, and can be a fun family activity. Next piece of good news, NDDOT receives a build grant. We mentioned this before, but again, shout out to our director of DOT, North Dakota DOT, Bill Panos, and his team for being all over on top of applying for these federal grants and putting in great grant applications, because we know these aren't always awarded. So good work to them for receiving this. But over the past 20 years in North Dakota, as we've been in this prolonged wet cycle, there have been over 350 grade raise projects or riprap projects on North Dakota state highways. Of those 350 projects, 237, they weren't planned, they were emergency repairs, which may have only been a temporary solution until a permanent grade raise could be constructed. And several roadways across the state, again, are in danger of undergoing going underwater. Anybody that's traveling across the state, east to west or north to south, knows where some of these are, and knows that again, this year there was real challenges around many parts of the state in terms of road grades. But this spring, the NDDOT applied for a build grant. Today, we were notified that we were awarded $22 million grant to raise the grade in 13 different locations across the central and eastern part of the state. And again, this, instead of doing emergency, we can do permanent raised grades, which again is a great way to build resilience for future high water moments. But we'll be able to protect these roadways from going underwater, increase the safety for the traveling public. So again, congratulations to NDDOT on that $22 million grant. In the under the gratitude section, we've got another story of that I guess I would call good news, but gratitude. Gratitude here goes out to all of our, not only our law enforcement officers, both when they're on duty, but when they're off duty. Last Saturday morning, a medical emergency occurred at the MDU Community Resources Bowl, which is, for those statewide that haven't been there, that's the beautiful stadium here that's shared by a number of collegiate and high school and youth teams here in Bismarck-Mandan area. But it was opening day of Bismarck youth football day. An elderly gentleman from Bismarck collapsed as he entered the fan seating area to watch his grandson play youth football. Off-duty highway patrolman and recently promoted to lieutenant from sergeant, and I would also say a good friend of mine, Steve Johnson, ran to the victim when he saw him fall, quickly determined that he was suffering from a cardiac arrest. Off-duty Bismarck police officer George Huff, who was there as a coach, was leading his youth team in pre-game's warm-up, rushed to the man's assistant. Another off-duty North Dakota highway patrolman, Sergeant Derek Arndt, ran to his vehicle to retrieve his AED, and I'd say thank you to the legislature and others for making sure that we've got automated defibrillator devices in each of our patrol cars. He retrieved that, had it hooked up to the gentleman within a couple of minutes. Johnson and Huff teamed up to administer chest compressions between multiple AED shocks. The individual was revived. Other coaches and fans assisted in emergency response. Several other off-duty police officers assisted in crowd control, including helping to calm young children who had witnessed the incident. Later, a relative of the man reported that medical personnel were confident that the first aid response of the AED and the chest compressions had truly saved his life. And I think for all of us, this is just a great reminder, particularly during these times when there have been such a challenging environment for people to work in law enforcement. It's a great environment that here in North Dakota, our law enforcement officers are out there every day working to protect the public and save lives. And whether they're on duty or whether they're off duty, and they may be just there coaching their kids or watching their kids, they don't hesitate to spring into action when someone's life is in danger. So thank you, Lieutenant Johnson, Sergeant Arndt, and Officer Huff, for your swift and life-saving response. We know that you represent the spirit of all the law enforcement in our state, and we're grateful for your service, your professionalism, and your representation of the state and community. And in closing, gratitude quote from American author and Amy Collette said, "Gratitude is a powerful catalyst for happiness. It's the spark that lights a fire of joy in your soul." And again, I would just say again, deep gratitude for our law enforcement, and they literally were lighting a spark that reunited a soul last week. So again, thank you to all of our great law enforcement. We'll be back here next Wednesday. We've got a full week of constitutional meetings and presidential briefings and other things, so it's a challenging time, so we'll invite your flexibility. Next week we'll have our first morning press conference, the only time that we can get it worked in next week, but next Wednesday at 10 a.m. Will be our first morning press briefing, Wednesday, September 23rd. After that, we'll hope to return to these afternoon slots, but that's the best time we could make it work across a number of different conflicts. So until then, remember to be North Dakota smart and help us save lives and livelihoods. So with that, we'll stand for questions. And again, thank you all for being here. I guess we're going left before we go right. So Jack, and then Jeremy, and then Jacob.
If you wouldn't mind, Governor, I'd like to go back in time a bit. In January 2018, you said you would absolutely support a primary seatbelt law in North Dakota, and the legislature last year considered but defeated this bill amid arguments of personal freedom. One representative said in a floor debate, "Should we continue to erode our freedoms by choice by making this a primary offense?" How is your decline to issue a mask mandate different than your support of a primary seatbelt law when personal freedom and responsibility are arguments in both debates?
Well, I would just say that I'm going to stand by both of those decisions, and maybe there's some theoretical conflict in holding those two views, but I would say that the data is very, very strong for seatbelt saving lives. And I also know that when a life ends in a death in a car accident, it's immediate, it's violent, it is. You talk to anybody who's lost someone, or you know anybody who's lost somebody in a car accident, it's irreversible in many cases. And even if people live, they can have serious injuries, that can change their life. And the people that have to come upon those are the public servants that I was just talking about, whether it's our highway patrolmen. Talk to anybody in the North Dakota highway patrolmen, at some point in their career, they've come across a fatal accident. And the people would have lived if they just had worn a seatbelt. And so you say to yourself, okay, is this something where we can not have any cost on the individual? Cars all come equipped with seat belts. They didn't 30 years ago. I mean, now they all have seat belts. And so it seems to me like this is a well-established well-established science that's been around. I mean, this seatbelt research started in the 1970s, so it's gone on for 50 years. And North Dakota, we're just on the tail end of this, of sort of understanding that. And again, when you have a seatbelt law that, as it's been written in the past, and I would encourage the legislature to propose one again under Vision Zero. It's supported by the Highway Department. It's supported by the Highway Patrol. It's supported by all the workforce safety. There are many corporations where their drivers drive for a living. Virtually all those corporations have seatbelt requirements, and so again, this is seems like a bit of a no-brainer, based on everything that's there. So I hope that we can move that way, because again, it would be nice to go through a month in our state's history without having any deaths from auto accidents. We're still close to over 100 a year that die, and in virtually all those cases, they could have been preventable if people had had a seatbelt on. Now, you try to connect that with masks. If I'm sitting in my driveway and not going anywhere and wearing a seatbelt, I'm not helping anybody else. Okay, but if I'm putting a mask on and going into public, I'm helping other people. And so this is a different thing. This is a community thing. We're all in it together. It's not just about who's behind the wheel and who's moving. This is about a virus that can only live and only transport itself, in human bodies. And I think, again, that we don't see the efficacy of having a mandate on masks increasing compliance. It might actually do the opposite in North Dakota. So we're trying to slow the spread. We're not trying to increase government. We're trying to be, pragmatic and smart and understand this. And there was a recent study that just actually came out that actually said that the fallacy of trying to say, well, these states did this, these states had these mandates. Well, the states that had those mandates and had high compliance probably had a majority of the people that wanted the state to have a mask mandate. We're in a state where the majority of people don't want to have a mask mandate, and so it's all contextual relative to the context of the situation that you're operating in. And so that's why, again, trying to say that if uniformly applying things across the breadth of our country doesn't make any sense. That's, again, it's a beautiful thing that we've got 50 states and we can have 50 cauldrons of democracy or 50 platforms of innovation. And we're going to continue to do in North Dakota with the thing that we think saves the most lives and saves the most livelihoods. This dual goal that we have. We're not just focused on one, we're focused on a dual goal, and for not having that here probably makes sense, because if I thought by not having a seatbelt law that we could get more people to wear their seatbelt, that's the camp I'd be in, because in both cases I'm for compliance. It's just two different methods to get to the same place. Okay, Jeremy?
Governor, Cass County has seen a pretty sizable increase in new and active cases over the last 3 days specifically, and the county now meets the criteria of a moderate risk county enrolling average active cases and positivity rate over the last 2 weeks. Why isn't that county moving up to yellow?
Well, I'd say there's a couple different things that go into that. One is that they're, I'd say, more on the bubble. We said we're going to use judgment. We talked about Stark and Williams being close to 10 or above 10. Cass County is close to 5, just over 5. So their rate is half the rate. Their rate per capita is substantially lower. And again, as we've seen in both Grand Forks and in Cass County, we've got a higher percentage of the positives are in that 18 to 29 age group, and you get into Burley, Morton, and Stark, some of these counties, we've got a lot of people who are positive that are 70 and older. So the risk levels are different in terms of what can lead to hospitalization and death, and those are things that we look at. If Cass keeps climbing the way it is, they'll probably would be considered a candidate to move up, but they're also doing a lot of testing. We did have a great effort last Saturday. I think close to 1,000 NDSU students were tested last Saturday, which was our largest campus testing. And great support from the university and the student leaders and the university president, and getting the word out and getting people to show up for testing. So we're trying to look at the data that underlines the top level numbers to really see, but in particular, where the case spread by age is something we're looking at, because that's going to determine whether we're going to get pressure on hospitalization or not. But thank you for following the numbers so closely. Jacob?
Going along those lines, you recommended the mask being worn for some counties that have been moved or are in moderate, but it's just a recommendation. Meanwhile, you have a request for proposal out for $1.8 million to an agency to create some PSAs and whatnot for COVID initiatives and whatnot. I'm assuming the effectiveness of mask wearing is going to be included in those PSAs. $1.8 million seems like a lot of money for something you could require for free.
Well, I think, again, you could require something and have less compliance, versus try to educate people and have more compliance. And I think when we focus on individual responsibility, part of the way people can make a choice on whether they see it as a infringement on their own rights, or do they see it as a way to give back positively to their community, their neighbors, their families. And so it turns out we've tried a lot of different ways of encouraging things. Some of that has been, as you say, free. But I think whether it's when you take a look at public health over the last 30, 40 years, when we've really moved the dial on things that matter for public health, whether it's like smoking, there have been, tens of millions of dollars were spent on anti-smoking campaigns and targeted at youth, and they were relatively effective until vaping came along, and then we had a resurgence. But the anti-meth campaigns, which ran, including in our neighboring state in Montana and others, where lots of money was spent, but they were effective in helping educate people about the real dangers. The federal government, of course, provides money through public health programs for one of the elements, longstanding elements of public health is public education. So this fits in line with that, and we're choosing to spend a small portion. I guess this is about 0.2% of the money that we got to the coronavirus relief funds on an educational component. And it, again, would seem to make sense in a state where we know that mask mandates at a state level are not likely in our future, that this is a way to try to help educate people about the benefits, because there is, what's also free is misinformation, and there is literally, hundreds of millions of dollars or billions of dollars of misinformation on the internet on the other side of this. And so, whether or not, I guess the question is not, can you do a campaign that has the breadth and the reach across our state? We'd like to try to do it efficiently and do it on social media, do it in a targeted way, and see if we can be smart about how we do it. But I think it's a good investment. I'm going to keep going around, so I'm going Dave, and then we're going counterclockwise back to Tom, or I guess clockwise, excuse me.
Governor, on the census, isn't time really running out very quickly in order to get this accomplished?
It is, and I'd have to refresh on the deadline. I also think there was some court action where people are trying to push that deadline back further, and so Dave will follow up with you and get you that. But initially, yeah, we were running up against a end of October deadline for those counties that were in the 30% range. That's not much time. Lane?
Governor, I was just curious if North Dakota is using the rapid testing anywhere in the state, and if so, what is it necessarily being used for, or who is using it?
And before I answer that question, for all of those Viking fans that are used to their usual season disappointment at the beginning, that Lane's wearing a Green Bay Packers jersey here today. But the rapid testing, we have received some shipments of the testing from Quidel and Bechdel Dickinson. These were the $25 per test that were talked about at the national level in early August. Some of those have been shipped to nursing homes. We are following up this week to see if we're on the list or about ready to receive some of the $5, but even more accurate Bionox, the Abbott, the $5 15-minute tests. We do have enough capacity. I mean, and the federal strategy for distributing those tests was to try to get them out to all of the long-term care facilities in the country, and they were focusing on skilled nursing. North Dakota was ahead of the nation because we were already doing testing at assisted living, basic care, and skilled nursing, and we had the capacity to do it with the PCR tests through our lab. Other states weren't getting the testing done, didn't have the capacity, so these tests were meant to be a low-cost, high-capacity way to try to fill that gap. When we talked to Dr. Birx on Saturday and we indicated, hey, if we have enough capacity to keep doing what we're doing at a better and higher rate than what now the CMS, which is the part of Health and Human Services, the Centers for Medicaid and Medicare, the CMS, that they were now requiring for long-term care, if we could do that, could we repurpose the rapid tests to another thing? And she said, absolutely. So some obvious things come to mind. One would be testing for visitors coming into long-term care. Another could be for using as a rapid tool if, say, we had an outbreak in a school building where you could go in and test a lot of people quickly and get the results and say, okay, these are the positives, these are the negatives, and then sort people, if you will, by, sort of who's got a quarantine and who can stay in school. So I think there's a number of ways those rapid tests are real game changers for us, but they have not yet been deployed, and there aren't any of them in our numbers yet, but soon. And as I've said before, I think, again, as our nation looks for something hopeful, if we got the capacity for some of these manufacturers to produce 50 million tests a year and distribute these, this is going to be could be something that could help get stadiums filled again and could help get concerts going again, could help a number of things going again because of a $5 test added to a ticket price for events, probably is in the price range where it could start to really be effective as a way to ensure that everybody in a large gathering were all negative at that point in time. Okay, online.
Scott Hennon, WZFG and KFYR Radio. You've always said your focus is on protecting the vulnerable. Now college kids seem to be more of the focus. Are you testing enough in long-term care?
For Scott, the college kids are the focus because of they have the potential to be asymptomatic spreaders, and because of their high number of transmissible moments that they're going through, and because we've also got college kids that work in college, nursing students and others that are also working in long-term care facilities, as I said. So us understanding the level of spread in the community is really important for us to help manage manage it within the long-term care facilities. And where we've seen places in the counties where we've seen higher % positive rates and higher case rates, that's where we're also seeing things show up in terms of the challenges that we're having in long-term care. So, the focus hasn't changed. It is about protecting the most vulnerable, but having surveillance strategy testing for those that have contact with the most vulnerable, as opposed to the most vulnerable directly, is a one way that we're going to get at that in a very comprehensive way. We'll do one more online and then we'll circle over to Tom.
Jean Shemp, Hometown Radio Group. Because unique individuals and serial tests are two distinct groups of people, wouldn't it make sense on a statewide and national level to track the positivity rates from both groups separately, especially now that more states are conducting serial testing? And would this help end the debate on how to track positivity rates?
The quick answer on that is, in my mind, is no. for Gene on that is because tracking the positivity rate on the total tests we take in a day makes complete sense. Tracking it only on unique individuals, the only way I've been able to describe it, in which we finally were, I guess, able to get through with the COVID tracking project, is it's the math that would not allow you to get out of 3rd grade or 4th grade, because in that case we would be, when we're just doing unique individuals, but if we had a positive showed up in someone that was being serial tested, they wanted to count the positive in the numerator but not count it in the denominator. And so, and that's where we ended up with these really inaccurate readings, because it wasn't reflecting the level of the comprehensive testing we were doing. So we're reporting it, and we'll continue to report it. We were reporting it 2 ways, unique and total. We now have a new thing called test encounters, which we're reporting, which will be slightly lower than total tests, because on test encounters in other states, there were people that might have been getting a rapid test in the morning, and then if it was positive, they were getting rechecked with a PCR test in the afternoon. So they were having 2 tests in one day. They didn't want to double count those because it was one individual with 2 tests on the same day. We understand that. So there is very little of that happening in North Dakota, but we are now reporting separately what's called test encounters, which is slightly less than the total tests. But running the positivity numbers off of total tests or total encounters is a way to accurately reflect the level of spread that you would have in any given community, and we'll stick with that. And again, very few states are reporting unique individuals. We started doing that early on, and that's where some of the confusion came, because maybe we were overly transparent, because people grabbed that number, which was a denominator almost 40% lower than our total testing, and that's what was dramatically skewing the positivity rates on some sites, including it's still tracked inaccurately on COVID Act Now, and a number of other sites are still pulling the wrong data, but we've got a SWAT team, and we're working through all these volunteer data gathering sites to make sure that we can get them to all be accurate along with ours. That'll make it easier for all the professionals that are here every day and those listening in. Okay, Tom?
Yeah, but I want to drill down a little bit on some people that are really affected in the west part of the state, namely the students and parents of students that are going to District 8 and District 1. They had a lot to deal with in just the last few days. Williston High School football has been benched for 2 weeks because of COVID. They have a protest scheduled for tomorrow morning at 8 o'clock at the high school to protest against the mandatory policy on wearing a mask. They've got a plus 9% positivity rate in the rolling average in the last 14 days. And they've got a very high positivity rate at the Williston State College just this last week. So these kids have all this to think about, and the parents have all this to think about. I wonder if the governor will take a moment and address those families as to what you feel in regards to this.
Well, I think whether it's Williston or any place in the country, parenting during a time of COVID or being a student, whether it's elementary or junior high, high school, or university level, being a student during a time of COVID presents all kinds of challenges. I think it'll be interesting to see 20 years from now in our country, the experiences that young people are having today, how that shapes them as leaders, how that shapes them as citizens, how it shapes their desire to be engaged. So I think it's going to be an influential time in the history of these young people's lives. But I would say to the local leadership up there, whether it's the county, the school district, the city, the university, everybody working together. I mean, the key thing is doing what we're doing, what we've always done in North Dakota when you have challenges. And Williston, like any other community, has shown enormous resilience. They've gone through one of the biggest booms and one of the biggest challenges in terms of downturns of any state in our nation, in the history of the state. I mean, what they've gone through in the last 5 years. And so I've got complete confidence that the city of Williston is going to come through this stronger than ever, and I imagine the kids will too. But, as somebody that, I couldn't even concentrate when I was in high school thinking about the next football game. And so, it was what was the complete focus about, particularly if you had a rival coming up or a rival game. And so I really feel for where these games are getting canceled for kids, that's a loss. But I know that they'll get through that as well. And everybody learns from all this. But I'm sure everybody, like I said, come through stronger than before.
Follow-up, Governor.
Yep. Okay, all right. Jack, I'm going to zip around this way because I got another thing they're trying to get me to. Okay, Jack?
Is the metric for COVID-19 task force to get their 14-day positivity rate below the state's average, is that still a good metric? And why wouldn't a static target be a better goal?
Thank you for bringing that up. We did, I forgot to mention that today, but we did make a decision today that the static target would be better. And so the target on all these task forces to get below 5%. That gets you in the green zone for most all the national reporting areas. And again, for us to get into that, that's a good goal for us, particularly with the high amount of testing that we're doing in the state. Jeremy?
Governor, both of the Canadian provinces that border North Dakota have been much more successful in preventing the spread of COVID-19 than really any of their American neighbors, including North Dakota. I know you've spoken in the past with premiers and officials up there. I'm wondering, is there something that they're doing that's working? What have they told you about their response?
Well, this came up in a meeting the other day, and I'm reaching out to them, and I'll be able to give you an answer to that before next Wednesday, because I plan to talk to both Manitoba and Saskatchewan again to learn, because the place I'd start is trying to make sure I understand their data and how they're doing it, and what controls they've got in place. But again, they based on the numbers, there must be some good things going on up in Canada, and good to learn from our neighbors. Okay. Tom, and then Jacob, and then we're done.
Real quick follow-up. One of your supporters asked, how are you coping?
Me personally?
You personally?
I would say at a time, we've been since Brent and I took office, Brent Sanford and I took office. When we came into office, we had DAPL was going on for the first 76 days. Then we went into a drought. Then we had hundreds of wildfires in western North Dakota. Then we got into spring flooding, fall flooding, spring flooding. So we've had one disaster declaration, one emergency after another. We had the budget crisis where we had to cut $1.7 billion out with the legislature. Now we've had a bit of an economic recovery. Now we've had a second collapse in 3.5 years. So it's been the crisis management has been really part of every day we've been here, and I'd like to say that we're the things that we learned in our life prior to taking these jobs and the things that we are doing right now are, maybe everything that led in our lives led us to be prepared to do these moments. So, but I appreciate the sentiment of someone asking how we're doing. But, Brent and Sandy are doing great. And the First Lady and Brent's kids, we're talking about his kids today. He's got kids back in school, one at NDSU and 2 here in school in Bismarck. And they're all, doing things, playing football, enjoying school. And the First Lady and I are doing great. And like I said, I'm probably happy that while I'm dealing with this, my parents are both gone, so I don't have to worry about any parents in long-term care, and my kids are all either out of college or doing college online by choice, and so I've got very few family worries, and I can devote my whole attention to the state, and it's an honor to serve, and it's particularly an honor to serve during a time of crisis. Okay, Jacob, and then we'll be done.
Quick, back to the RFP on the awareness and COVID initiatives and whatnot deal. Contract says that, or the RFP says the contract start date would approximately be today. Just wondering if a firm has been selected and what the price tag on it is.
Not up to speed on the RFP process on that, but we can certainly get you an update, or we'll make an announcement if there is one. But thank you. But anyway, thanks everybody for your attendance today. And again, repeating next Wednesday, 10 a.m. For next week, and then we'll get back on the afternoon schedule after that. But again, thanks everybody for tuning in, and thanks to our media for all of your great work. Appreciate it.